Dad, what's the best contraceptive method going?
Abstinence.
No, Dad, I really mean it. What do you prescribe in your practice?
Whatever I feel fits the individual patient's needs best. You see, today there are a wide variety of different things available. Condoms, birth control pills, diaphragms, jellies.
Condoms? You mean rubbers?
Yes, they've probably been used longer than any of the other contraceptives available.
Really? How long have they been used?
A prophylactic type sheath made of papyrus was used in pre-biblical days. The condom, as we know it today, was developed by Dr. Condom in the 18th century, and with the development of rubber processing, they're now made of latex. And strangely enough, when they were practically the only thing to be had, they were always used. Whereas today, where there are so many different things available, too often nothing is used, with disastrous consequences. Fellows take the attitude that it's entirely up to the girl to protect herself from pregnancy. And the girls, feeling it can't happen to me, or lacking knowledge entirely, take no precautions. Also, girls have told me that if they used preventatives, it would make them feel the lovemaking was premeditated and like a whore. That's not realistic, and reflects a lack of maturity and responsibility.
Getting pregnant could wreck a romance.
You better believe it.
It usually does. But to get back to your question, Bill, although the Catholic Church in some quarters is unofficially softening on the birth control question, the official position is no contraception allowed. So the practicing Catholic uses the sanctioned rhythm system for family planning, where the couple refrains from intercourse during the time of the month when she is likely to be fertile. This is usually between the 12th and 16th day after onset of the menstrual period in a normal 28-day menstrual cycle. However, not all females are on this normal cycle, and there is the occasional woman who ovulates at a time outside of the 12th to 16th day. Another factor is that sperm may remain capable of fertilizing an egg for as long as 48 hours once discharged within the vagina.
Dad, what about withdrawing during intercourse but before the discharge?
Unfortunately, this is not always effective either. There's usually a drop or two of sperm discharged from the penis during intercourse before a climax is reached. Although it's not a large amount, it only takes one sperm to fertilize an egg, and there are millions in each drop.
How safe are the rubbers, the condoms?
They're pretty good, but they have been known to break. However, this is rare, particularly if removed after discharge and a fresh one used if intercourse is resumed. You know, they were also reputedly designed to prevent venereal disease, since they limit direct skin contact.
Does it prevent pregnancy if a girl takes a douche right after sex?
Only to a limited degree. Upon discharge, the sperm are deposited adjacent to the cervix, the lower part of the uterus, which they may enter right off, swimming into the uterine cavity, where the douche can't wash them out. A douche is essentially effective only in washing out the vaginal vault.
Well, how about a diaphragm?
A diaphragm of the proper size, fitted by a physician, inserted in the vagina prior to intercourse, is effective, provided it's properly placed, shielding the cervix. That is, after a spermicidal jelly is applied to the rim and the inside of the diaphragm's cup. In my office, I always instruct the women to check the diaphragm, once inserted, to make sure it's correctly positioned. If it isn't, it's totally ineffective. It's also recommended that the diaphragm be left in place for at least 12 hours after intercourse, and the woman take half a douche prior to removing it and the other half after it's removed. Actually, she can leave it in place for several days without any problem.
Dad, what about the safety of the birth control pill? What's the experience in your practice? There are all kinds of articles in magazines and newspapers about possible dangers. Well, what's your opinion?
I believe they're a relatively safe, excellent contraceptive. In fact, the most effective method developed to date, other than total abstinence.
Oh, Dad.
As to the dangers of the pill, well, I feel the basic principle of administering any tablet applies here, Virtually every medication may have an adverse side effect on someone, even aspirin.
I didn't know that.
If a birth control pill works for a woman without side effects, it is an excellent contraceptive for her. If she has a bad reaction, obviously it is not, though it may well be tolerated by millions of others. I believe all medication should be viewed in this realistic perspective.
Dad, what's in birth control pills?
Female hormones, varying combinations of estrogen and progesterone, which are effective by stopping ovulation and changing the uterine wall so that it is not conducive to implantation of the egg. Differing dosages of these hormones seem to be better tolerated in one woman as compared to another. Thus, the practicality of the various pills available. They have a good history of clinical application, and in my practice, I've been very pleased with the results.
Don't you also prescribe the birth control pill to regulate goofed-up periods?
Yes, I do. And I also prescribe them for cases of excessive menstrual bleeding and for endometriosis, an abnormal condition of the female organs. With endometriosis, many patients have had the condition arrested in this manner. And when the patient wished to conceive, she stopped taking the pill and became pregnant.
That's great.
In this situation, if it hadn't been for the birth control pill, many of these women would have needed a hysterectomy, a removal of their internal female organs. And the clinical course would have been far different. They would never have been able to have children. Of course, any patient who suspects she's having a bad side effect with any medication should contact her doctor immediately.
Well, what's your opinion of the IUD, the intrauterine device? You know, the plastic thing that doctors place inside a woman, like, permanently. You know, the coil.
Guarded. The coil, placed through the cervix inside the uterus, doesn't prevent fertilization, but acts as a foreign body to prevent implantation of the microscopic egg. From a practical point of view, it is essentially a built-in abortion mechanism. However, I'm not overwhelmingly enthusiastic about its effectiveness, since I've personally seen several patients pregnant in spite of the coil. And in one case, the coil had perforated through the wall of the uterus. The patient became pregnant, and after delivery had to have surgery to remove the coil.
But lots of women do use it.
Yes, and where nothing else would suit their needs, I might recommend it. Also, informing the patient about the possible problems.
How about the gooky stuff? You know, the foams and jellies.
There's a fair variety of these products available that are spermicidal. That is, they destroy the sperm. However, they're not as effective as some of the other methods we've discussed. And as you say, it is gooky.
Are any of these things able to prevent venereal disease? I mean, beside the rubbers?
No. Actually, the most effective way to prevent and control venereal disease is to wash the genitals with soap and water and urinate soon after intercourse. And upon noting any sore, discomfort, or discharge from the sex organs, see a doctor immediately. If everyone in the country did this, venereal disease would become a thing of the past, instead of increasing, in spite of the antibiotics available to eradicate the problem.
You know, I think people get too embarrassed to go to a doctor right away, huh?
Yes, that's so. But unfortunately, venereal disease in a permissive society, even a limitedly permissive one, spreads like wildfire. I feel that if people are not too embarrassed to take off their clothes to make love, they should also be mature enough to seek professional help at the first sign of an infection and not spread it around.
Yeah, but like Bill said, some kids are still uptight about it.
And some adults. But doctors treat these cases as they do their other patients, as privileged and confidential. And in the situations where public health personnel become involved, they are the ultimate in tact and discretion. Everything possible is done to preserve the individual's privacy as well as eradicate the disease.
But isn't it true that some girls can have an infection and not know it?
Unfortunately, yes. Many girls have a slight vaginal discharge and may not notice any change with the onset of the infection. By the time they are aware that something is wrong, they may have infected others and developed a pelvic inflammation that could result in permanent sterility. But Venereal disease can be eradicated if everyone gets prompt treatment. At the first sign of infection, a sore, discomfort, or discharge.
I hear there's a lot of VD among homosexuals.
Yes, since many homosexuals are extremely promiscuous and engage in sexual contact upon the spur of the moment, literally with people they don't know and will never see again, this has tended to make venereal disease rampant in this group.
Well, I can see where it would. Ooh, they're freaky anyway.
Unfortunately, some homosexuals may make you feel uncomfortable in their presence. Many are social misfits because they are often psychologically unstable. In my practice, I've rarely treated a satisfied or happy homosexual man or woman, although one may occasionally come across some who seem to have adjusted into this type of life and make the best of it.
Dad, is there anything that can be done for a homosexual? You know, I mean, one that wants to go straight?
Sometimes he can be helped. If he sincerely wants to convert, a therapist who treats homosexuality can often assist him to attain heterosexual life, where he does have more of a chance for happiness and emotional maturity.
Well, where do lesbians fit in?
They are the female counterpart of the male homosexual who abhor sexual involvement with men and turn to their own kind for intimacy.
But can you always spot a homosexual?
No. Many homosexuals dress and act normally, and at the other end of the pendulum they go around in drag, such as a transvestite who dresses and acts like a woman, to the point where only close examination, and I mean close, reveals what gender they truly are.
Great, out of sight.
Appearances are sometimes misleading.
What's the most critical thing in someone becoming a homosexual?
The lack of identification as a child with the parent of the same sex, and the role played toward the opposite sex. This emotional development invariably occurring before the age of 5, and where there's an absence of good, healthy identification, we find fertile ground for the drift to homosexuality. The family pattern often found is that of a strong, domineering mother and a weak or absent father. And in most instances, the mother doesn't present a soft, feminine image, nor does the father present a strong, masculine one for the child to emulate.
But is there anything else?
In addition to this retarded emotional development, a lack of maturity. There's often a fear and insecurity of one's own sexuality and the ability to enjoy a natural sexual role.
Boy, you know, whenever I get the business from a queer, well, gee, I get so uptight I don't know whether to ignore it or belt him.
That's because you feel uncomfortable and perhaps have some feelings of threat to your own sexuality. I believe the best thing to do is to express your rejection to the overture simply and honestly with a no. There's no need for violence.
What about those who swing both ways, AC/DCs?
You mean bisexuals?
Yeah.
Bisexuals who select partners either with their own kind or with the opposite sex are people who, in their duality, jump back and forth across the fence between homo and heterosexuality, perversely seeking a good relationship wherever they can find it, and at the same time escaping from any deep emotional commitment. Whenever they become close to anyone, they skip away. There's a great variation in the homosexuality we see in this group, who are neither fish nor fowl. Usually they have strong feelings of sexual inadequacy and tend to be very unstable. Many bisexuals are married and have a family and sexually stray on the side.
Ugh, the whole business still turns me off.
It all sounds a little sick to me.
Be a little tolerant. Though we may not like their choice, this is the way of life they've selected to follow, the same as you're free to select yours. Everyone has the freedom to make their own choice.
Dad, is it true that many prostitutes are lesbians?
Yes, that's so. Many prostitutes will have sexual engagements with women as well as with men, and many in their off-work time will seek sexual and romantic liaison with women rather than men.
Well, why is that?
Well, as I told you before, many prostitutes hate and resent men. They need men for income and resent the dependency. They simply won't respond. So, as a substitute that avoids relating with men even on the most elemental level, they enter into sexual play with women who will masturbate them to climax. It's a substitute for intercourse. that makes no real demands on femininity and is a mockery to sexuality.
Yeah.
Bill, practically viewed, sex with a prostitute, except for paying for her favors, is similar to having intercourse with a girl you care nothing about, since both amount to intravaginal masturbation, devoid of involvement or emotional relating.
But would you say the same thing for self-masturbation?
Not quite. That has a slightly different aura. Self-masturbation is essentially a substitute for intercourse to ease the pressure of intense sexual need, where the individual doesn't have anyone to relate to sexually due to social circumstances, emotional age, or marital status. And masturbation occurs universally in all cultures.
Is it harmful?
No, it's definitely not harmful. It's also now believed that the sensual sequences of masturbation may be a means by which people become aware of their own body's sensual responses prior to the time when they're able to have intercourse.
Boy, you hear weird stories about what'll happen to you if you masturbate.
Like you'll go blind, hair will grow on your hands, you'll become an idiot. It's all rot. It's not so.
I'm glad to know that. I hate feeling like an idiot.
Idiot.
Though masturbation may be a pleasurable source of gratification when there's no loved one to have sex with, it's still a substitute.
You know, Dad, I sometimes find it hard to apply some of the things you say to me, since I've never had experience with what you're talking about.
Even though you haven't had the experience, they do apply to you. They apply to all of us. And sooner or later, you will be exposed to all of these things, either from a distance or intimately. For example, a girl cannot realistically have intercourse without contraceptive precautions and think with certainty that a pregnancy won't occur, like it can't happen. It can and does.
Yeah, but what about the girl, well, you know, the girl who isn't married and gets pregnant? What's the best thing for her to do?
Well, that's generally decided by a multitude of factors, and it's emotionally traumatic, whichever course is pursued, like have the baby and get married to someone she may not love, have the baby and remain single, give the baby up for adoption, get an abortion, a decision based on emotional maturity, religious beliefs, family attitude, advice from friends, financial circumstances, the welfare of the baby, feelings toward the father, interruption of school and future plans, just to name a few. It's tough. However, as she may have thoughtlessly become pregnant, she is now involved in the decision of what to do about it.
Well, if she wants an abortion, what happens?
It varies with the law in each state, and several of the strongest formal churches are totally opposed to abortions under any circumstances. But, for example, in one state, if the girl is within the 20th, but preferably within the 12th week of pregnancy, mentally depressed, with ideas of self-harm, suicidal feelings, and in cases of incest and rape, the pregnancy can be terminated. A letter from the patient requesting the abortion and one from the attending physician explaining the case are submitted to a hospital abortion committee, who has the authority to approve the procedure if the case complies medically and legally.
How do you feel about these laws, Dad? I feel a woman's body belongs to her, yet it seems it's always some man that legislates what she can and cannot do with it. It just doesn't seem quite right to me.
I feel that therapeutic abortions should not be governed by any state law, other than that they be performed by a qualified physician. I also feel that the decision to do the procedure should be made by the patient with the assistance of her doctor, a therapist, and perhaps her minister. Fortunately, understanding medical counsel is available for everyone now.
That's super.
And every girl who has an abortion should have some in-depth analysis to seek out the psychological reasons underlying her pregnancy and come to grips with them. If she doesn't learn from the experience the real reason for her actions, the pattern is often repeated, and she may turn up pregnant again. Like the situation where, in this dramatic way, she's trying to get her father to pay attention to her, or to emotionally say to her mother, "I'm as good a woman as you are any day." These are emotionally bad, destructive reasons for pregnancy.
Is having an abortion very dangerous?
In skilled hands, barring any extraordinary complications, it is not. And the patient is able to leave the hospital the day after the procedure is done, usually with a prescription for birth control pills, which are a lot less expensive and far less emotionally traumatic. However, with illegal abortions done in a motel, someone's house, or a dirty office, the results were disastrous, with frequent hemorrhage and infection, an experience that was quite often a veritable nightmare of pain and guilt.
Dad, there's no copping out on one's sex life or its consequences, is there?
No, honey, there isn't. And as you mature, you must make your own decisions, with whom and in what circumstance you will become sexually involved. In the final analysis, you are responsible for the results of your actions.
I guess that's part of growing up.
Yes, it is. As you and Bill, all teenagers, enter the adult world, you have to be prepared to make adult decisions and assume the responsibility. There's always help from Mom and myself, from all parents who care, but we can only advise and stand by you, and then, only if you want us to. With maturity, the freedom of decision will be totally yours. It's your life, your body, and, yes, your world.